Thank you very much indeed for joining me this morning. Could you just explain the position? Clearly, you're in favour of the strikes. As you've heard, the NHS in abject meltdown, people very concerned about people suffering from heart attacks and strokes not getting the treatment they need. I'm not entirely sure the public's on your side.
I think the public is on our side. We saw that last Thursday when hundreds and hundreds of people came to the picket lines and support the strikes. All the polls show that it's over 60% of the public support these strikes. It's not just about the money, it's about safety. And when you describe the situation that potentially can happen today and tomorrow, is happening every single day. Every single day, we cannot deliver the care that we want to deliver. We're putting patients at risk because we don't have enough resources, enough staff. And that needs to stop, because that lack of staff, lack of resources is costing life. The number of litigations have skyrocketed in the last few years. Every year, £7 billion go just to pay people because NHS is making mistakes, because we are tired, we are short of staff, and short of staff have consequences because we cannot do the job properly.
I completely hear what you're saying, and obviously I worked in the NHS as a doctor. I understand the conditions are very difficult. It's very hard being a clinician. It's very hard being a nurse. I get that. And I also think that nurses do deserve a pay rise. My question, though, is you said yourself that patients' lives will be put in jeopardy as a result of the action that the RCN is taking. And the question I have is, you know, I understand that you've resorted to strike action as a last resort, but this is a very difficult time, as well you know, for the NHS. We're in the middle of winter. We already have unprecedented numbers of people seeking care. Is striking right now in the depths of winter, when we are in real trouble anyway, is that the right time to actually have this strike?
It's never a right time to strike, and today is a sad day, but we've been pushed to strike because it's the first time in 106 years, 107 years that we took this action. It's because the government don't want to sit down and have a plan. We only want the government to sit with us and discuss just pay conditions, work conditions, everything the same have they done in Scotland. The strike has been called off. They've been an offer. Some of the unions have accepted the offer. RCN have just completed the ballot and to see if the members accept it, and the strike has been called off. And also, the offer has been to the table is only, I think, is around 8%. The 19% is a symbolic figure to show the public that's the amount of money that we have lost in the last 10 years. Our salaries have been decreased by 19% if you compare with inflation. That is a symbolic figure. And I know that sounds unrealistic, and I'm sure that if the government sit down with us and have a negotiation, then we can reach assume that reflects also the value of the nurses, and also the problem needs to attract the future of the nurses and stop nurses leaving the profession. At the moment, retention and recruitment is a big problem, because the young nurses are leaving quite quickly, and also a lot of nurses are retiring every year. We need to put a stop of that and improve the working conditions. At the moment, the nurse's salary has gone from the top base in the European now to the bottom. We are the lowest paid nurses in all the continent, and that is shocking.
So you mentioned a number of things here about it not just being about pay, but also about conditions. Steve Barclay has said he is willing to meet the RCN. He will not talk about an increase in pay. But I know as well that you do need improved conditions. For example, having hot food at night, making sure that actually trying to do your job, you can actually be done properly, that you actually have proper facilities and so on. Steve Barclay said he will meet with the RCN, but will not discuss pay. And yet it seems that it's so intransigent, and the RCN is not sitting down with the government. And patients are going to suffer as a result.
Patients are suffering at the moment. Every single day we're missing treatments because we're short of staff. Every single day we don't have enough appointments to give to people. 7 million people are now on the waiting list. 10% of the population in the United Kingdom are in a waiting list for some kind of treatment in the UK. If we put more nurses, if we attract more nurses, if we increase the starting salary, that will attract this future generation of nurses. We cannot have a starting salary of £13. That's nearly the same amount that you can get in any supermarket nowadays. That needs to stop. We spent 4 years in university. We have knowledge. We showed during COVID pandemic that we just not give tablets and put bedpans. We have a lot of knowledge that saves lives.
Indeed. Let me just ask you. Let me just ask you this. You are asking for 19%. I mean, that is just a crazy amount of money, given what other people are going through. Many people haven't had a pay rise. They haven't had a ring-fenced income, and so you want 19%. I understand you're saying that nurses have been chronically underfunded. What level would you settle for?
Anything closer to the inflation at the moment.
So anything around 11%, you think the RCN would accept?
The RCN will then we need to have an offer. That's why it's a negotiation. We need to sit down. That's the starting salary. On an ideal world, yeah, 119%. I know that's not realistic. I know that the government cannot afford it. But let's talk. And then when you negotiate, you then will have a figure, and then they will put it to the public. And I know most of the nurses, most of my colleagues will settle for a figure around the inflation. Look, we had the last 12 years, we had a pay cut every single year because inflation is going to up. Again, now the 5% is giving us a 7% pay cut this year. I don't think that's acceptable.
But also, we believe that inflation has now peaked, so it was 11.1%, is now 10.7%, it's believed it will come down. So the government is standing still because it believes that inflation will come down. It's offered what it believes is a good pay deal, but you think that actually the union would settle. The question I have for you, and I am really torn, because I really want nurses to get an increased pay deal, but at the same time, I just don't think it's acceptable to strike right now and put patients' lives in danger.
But we are having a situation that patients are in danger every single day.
But you're making it worse.
Open the news. No, believe me, this is the first time that the hospitals are looking at safe levels. And as I was told last week, there were more nurses on the shift than not on every single day. Because also we had doctors coming to help us, all the NHS rallying around. The same happened when the junior doctors strikes a few years ago. There was no incidents. No incidents were reported last week when we strike, or last Tuesday. I mean,
well, that's not true. That isn't true. I mean, operations were cancelled. 16,000 operations were cancelled. We also had all of those outpatients, hundreds of thousands of outpatient appointments being cancelled. People in pain waiting for their procedures get cancelled. Not on.
Every single day, operations get cancelled because we don't have enough staff. Every single day, procedures are cancelled, or patients' clinics. Every single day, you go to any hospital, every single day, all the routine things suffer because we don't have enough beds, we don't have enough staff, and they get cancelled on a daily basis. Nothing that happened last Tuesday is new. Nothing that happened today is new. Patients are being put at risk every single day. That needs to stop. The figures show that litigation have skyrocketed. We don't go to war to make mistakes.
That is a complex question, and litigation comes about from a number of things. Medical negligence. It's not just about staffing of nurses, as well you know. But also, just let me read a couple of comments to you. John in Lincolnshire said nurses have lost their reputation. They will not restore it for a generation. I've got another one saying the Royal College of Nurses should be stripped of its royal charter. People are very angry.
Well, that's your audience. By other side, I go to the streets, and I will see again today a lot of public supporters. There's a lot of polls that are still saying that we have around 60% of the public support over the strikes. And on a daily basis, I'm receiving messages to my social media also supporting. There's also some people like some of your audience that also don't agree with us. But that's why we live in a democratic society that everybody is entitled to their opinion, and I respect their opinion. But the reason we go strike is because we believe that we are at the end of a tether, that we no longer carry on with the levels of staffing, and that 4% of the pay rise will also damage the future, because a lot of nurses will leave, and a lot of also we will fail to recruit any new recruits in the future. That's why we strike. We're not asking, for a lot of things that the government is denying.
Well, you're asking for 19%, which, if you work in the private sector, is just untenable.
Yeah, but for example, private sector have at the moment this year around 7% pay rise. That's the average.
Not all of them. Okay, fine, average.
That's the average. And the same, I just want an offer from the government similar to the one in Scotland, and I can guarantee that most of the nurses will accept, because you need to forget the unions are led by its people. And the union, if they have an offer, they will put it to the public. The union will not decide if they accept the offer or no. It's us who make the union, who we have an offer on the table, then we can decide. The moment we don't have any offer, that's why we're striking.
Well, so you have had an offer, though, because the independent pay review body came out at 4.75%. But let me just ask you one more thing. The RCN, I understand the passion that you have, and I understand that what you're asking for. The RCN has said they are prepared for these strikes to go on for the next 6 months. Are you, as a nurse, as an individual, are you happy with that?
Yeah, I'm happy as long as we listen, and I'm happy. I'm prepared to strike for the patients because I believe on an NHS that is safely funded. We want to save staffing. Where is the we don't have any safe staffing future. We need to put a plan. We don't have any plan. We're waiting for a staffing plan, for the recruitment plan and retention plan for the last years, and year after year it's been delayed. We don't have a minimal number of nurses that needs to be in a ward, because I know that if that passes a law, they will highlight how short of a staff we are.
I totally agree with you about staffing, but let's be very clear and not conflate the two, which is the NHS has never had so much money. The money is going in. It's not about underfunding. It's about making sure it goes to the right places, and that's what needs to change.
Well, it's true that they have more money than ever, but also it's true that in the last 10 years, it's not keep up with inflation. If the inflation goes above what the government is paying, then that means literally the NHS is underfunded, because if inflation goes up by 6-7% and we only increase the funding by 3%, is a gap. And also the demand also have increased significantly. This elderly population with chronic conditions, they not come from another planet. They've been living in here. The lack of plan is that what's put now the NHS in so much stress. It's not the nurses demanding pay rise, it's the overall management from the government and the whole lack of planning that now we are in this situation that on a daily basis people are dying in our wards because we don't have enough beds and we're making mistakes, and the NHS is crumbling by the mismanagement that this government, in my opinion, have done in the last 12 years.
Joe, thank you very much indeed for joining me this morning. That's Joe Pons at La Plana, who is a nurse activist and RCN member. The question I'm asking this morning is, do you think, given, and you heard the passion there from Joe, I don't agree with the points, all of the points that he made, I agree with some of them. Do you think that given the NHS is facing near total collapse, the Prime Minister should capitulate? Is Rishi actually wrong? What are your thoughts? 0344 499 1000. Text the word talk in your message to 87222. Tweet us at talkTV. This is talkTV.